even better than the last. So let me introduce our speakers. Bassim Michael, CPA, CVA, and MS Tax, is the founder and president of OnlyForDentists.com, a division of Michael & Company CPA. Bassim and his team are dedicated to helping dentists understand their financial information, improve their profitability, and lower their taxes. For more than 20 years, Bassim has worked with hundreds of dentists throughout the United States to help them become better managers and leaders. Bassim is a frequent speaker on topics such as practice management, tax planning, and exit planning. He's been quoted in many articles and publications such as the Wall Street Journal, Dow Jones Wire, and many more. And please welcome our featured speaker, Mr. Bernie Stoltz, a seasoned motivator, public speaker, and acclaimed coach with over 25 years of business leadership in the healthcare community. Bernie Stoltz is the founder of 5 successful companies before co-founding Fortune Management almost 30 years ago. Congratulations.
Thank you.
Bernie has conducted thousands of training programs across the country to help thousands of doctors become their personal and professional best. Bernie coaches and has provided practice management instruction at UCSF and UOP, as well as the Pacific Laser Institute. In addition, Bernie is a regular contributor to many publications and speaks throughout the world. Bernie has dedicated his life to achievement in areas of marketing, public relations, advertising, business management, and principle-centered leadership. As CEO of Fortune Management, the world's largest executive coaching organization for doctors, Bernie leads more than 70 coaches in over 50 cities throughout the United States and Canada. So welcome.
Nice to be here.
Thank you for having us.
Well, crazy times unfolding, huh?
Oh, it's amazing. And, you know, I'm really excited about today's program because we're going to give doctors a chance to maybe step back a little bit and stop just following all the chatter and you know, all the news, and we start focusing on, okay, what's the way forward and how can we move forward? And I think that's really one of the reasons why I'm so excited about today. And no one is probably going to be better to show us the roadmap, but probably Bernie Stoltz and his team at Fortune. So I'm really glad to be here today with Bernie and Megan, and of course I'm very thankful for all the attendees who are going to be joining us today. And I just want to also let everyone know that we still have one more program on Monday where we're going to be hosting Leo Ramshian from HR for Health. And for Monday's program, we're also going to be covering all the tax incentives that were part of the CARES Act. And we will be covering as well all your HR questions. So there's still more to come. With that, I'm going to share my screen with you. And I'll start my portion of the presentation, and we'll save the best for last because I think, again, Bernie's presentation is going to be very outstanding, and you should be taking a lot of notes today.
Thanks, Bassim.
My pleasure. My pleasure. So can you guys see my screen?
Yes.
All right. Okay, perfect. So today I'm just going to give you an overview of what we're going to be covering. So I know you've been bombarded with a lot of information about you know, the CARES Act, the Families First, Coronavirus Response Act, all kinds of new laws that were being thrown at all of us in the last 3 or 4 weeks. On top of that, there's OSHA compliance and all kinds of stuff. So today I'm just going to give you a quick snapshot of what's available. We're not going to go into a lot of details because I think we covered a lot of details on the PPP last Monday, and next Monday we're going to be covering a lot of details on those programs. But today I'm just going to give you a brief overview of what's available to help your practice. Then I'm going to help you, sort through these options and maybe give you the roadmap on deciding, well, which tools should I be using? Because maybe you shouldn't be using all of them, or maybe not all of them are going to be available. And then we're going to try to spend most of the time of my presentation on understanding what the numbers mean. And then after Bernie does his presentation, we'll open it up for Q&A. So, again, there has been a ton of talk about the PPP loans, and I think by now all of you are becoming experts on how to calculate the loan amount. And by the way, I was just on a conference call before this meeting with the SBA director from Santa Clara County. And as of today, the funding for the PPP loans and the idle grants has been fulfilled. So there's no more money available from the SBA to fund those loans. But the good news is I think there's still other options available if you weren't one of the lucky ones that received approval on your PPP loan application. And one of the things that actually the SBA person talked about is that if you applied early on, because I know, in talking with a lot of my clients, a lot of them applied the first day it was available, but they just never heard back from their lender. If you applied early on in the process, follow up with your lender and find out if, where your loan is in the process, because as long as your information was submitted to the SBA and you have an SBA loan number, your loan will be funded. So even if you haven't received the funds, but if you applied and your loan was submitted to the IRS and I'm sorry, not the IRS, the SBA, and you have an SBA loan number, there's a good chance that your loan will be funded. So if you didn't get the PPP loan, you might still have some other options. First of all, Congress may still authorize additional funding. So we know that the Treasury Department has requested an additional $250 billion from Congress. We'll have to wait and see what happens with that. You may want to check and see if you could, we know that the EIDL grants are done, but check and see if you could still get an EIDL loan. And you could go to the SBA website for that. There's also employee retention tax credits. So if your business or practice was affected by the shutdown, or your business experienced a reduction in collections up to 50%, so either or, and again, I think both of these conditions are going to be met by dental offices, there's going to be a 50% tax credit on wages that you pay to your employees up to $10,000 per employee. So the value of the credit will be about $5,000. And that's going to be available for those who did not get the PPP loan. So that's definitely a good option to pursue if you didn't get the PPP loan. Also, there's going to be a deferment of employer portion of Social Security and Medicare tax. But again, I'm not too fond of that option because in the past, when people get behind on their payroll taxes, sometimes it's hard to catch up. But again, I mean, on an individual basis, I think we can look at that option and see if it is a good option for some practices. And again, this option will not be available to those practices that actually had a PPP loan forgiven. So you could use it up to the point your PPP loan gets forgiven, which will be, if you got the PPP funds, we could see maybe in 3 or 4 months, you actually might get the loan forgiven. And then there's a host of other individual and business tax incentives that were passed as part of the CARES Act that, again, we'll be covering all of these incentives come Monday. Then there's another, I think, big resource that's available to a lot of business and practices at this point, which is unemployment for furloughed employees and owners, as well as there's this work share program. So the work share program is another program that's funded by the unemployment funds through the EDD. And again, we'll discuss this in more details, but basically, I think the work share might be a good option for practices after you get your PPP loan forgiven. So maybe you should, some practices should apply to participate in the work share program. So as you reopen your practice, you might be able to use that program if you don't bring everybody on full-time. And again, we can analyze that on a case-by-case per practice, but I think the work share option might be a great option as you open up your practice and maybe, not be at full capacity, but at partial capacity would be a good alternative for your employees to still work, but also make up the difference from the furlough by getting funds from EDD from the work share program. And we'll discuss all the qualifications for that on Monday. So now, how do you decide which options will be best for you? I think the first decision you need to make is you need to surround yourself with the right professionals to guide you and help you navigate through this complex maze of both opportunities and compliance nightmare. So I think finding out who these people are is going to be very critical. Just to give you an example, the CARES Act is over 800 pages. And, in my firm, there's four CPAs in my firm. And, some of us have a lot of financial analysis background. I have a master's in tax law. And I mean, just sitting down and reading the language of the act and the exceptions to the rules and the rules is mind-boggling. I mean, we sat down yesterday for probably a half a day trying to figure out, how this loan, the PPP loan, is going to be forgiven and creating scenarios. And that's like 4 CPAs and financial analysts sitting together and trying to figure this out. So surround yourself with the right people to help you navigate through this. And this team is not just going to be your CPA or attorney, but also a really good HR professional, practice management consultant that can help you set up strategies and has a lot of talents on board. So you need to figure out who your A team is going to be to help you get through this. Also, once you've developed your circle of trusted advisors, with their help, come up with a strategy to navigate through this, right? So don't try to do this on your own. And finally, once you have your strategy figured out, start moving forward and ignore the chatter. There is tons of chatter. To give you an example, again, we were advising our clients from day one, get your stuff ready. And as soon as the door opens for the PPP, apply right away. And again, there was chatter, on chat rooms and maybe other advisors that were advising clients to wait. And we knew from day one, this is going to be a very popular program and waiting would not be a good idea. I would apply, get the money, and then once you get the money, let's figure out what to do with it. So once you figure out your strategy, ignore the chatter and focus on your strategy and avoid all the negative news. It's not going to help you. Bernie, do you have any input on this so far?
Well, yeah, absolutely. I mean, first of all, one thing that you're spot on, Bassim, is the doctors have to avoid all the chatter. Over the last 30 days, there's been so much bad advice and misinformation given out. And I'm talking about credible law firms, credible national accounting firms who just didn't have it right. And, everyone's kind of creating this as it goes. But, I'm kind of proud of our position that we took. We, right on day one of the shelter in place, we put out, and in fact, I'll go over a checklist here, but we put out a list of 8 defensive measures that we wanted every one of our dentists to do. And quite frankly, every one of those 8 defensive measures has turned out to be true.
Right.
As far as the PPP program, here's my personal thoughts. First of all, there will be another tranche of money, probably about another $250 million. The challenge you've got right now in Congress is they're politicizing it. The Democrats want some things added to it. The Republicans want it to stay the way it is. And again, this is not a time for politicizing, and they've got to come to the table. But I'm pretty confident we'll see another $250 billion. So you should absolutely have your PPP application in, or have it ready if you missed the first chance. The other thing that was pretty interesting to me, Bassim, I don't know if you noticed this, but on day one, Bank of America got a lot of great press about being the first one to open their portals. And if you look at it today, in today's news and the reports we have today, 84% of the PPP money that's been funded has been delivered by small community banks. And the big boys, B of A, Wells, Chase, have delivered virtually nothing. So pretty interesting, but we told people right away, do not wait. There was some horrible information going out as far as waiting, crazy. Now, on a good note, I think everybody should continue the process of the SBA EIDL process. We are seeing really, really good news. Just yesterday, two of our clients right here in California, one was approved for $400,000. The other one was approved for $300,000. These are basic single operator, single dentist practices doing about $1.5 million a year. And those are fantastic loans. Those are 30-year fixed rate loans at 3.75%. And you can apply for both if the PPP comes back. But the advice that was asked yesterday was, well, do I go ahead and take these loans? Absolutely take those loans, because worst case scenario, you're going to have that money in your bank account and you've got 30 years to pay it back. The other irony of this thing that we're seeing is, there were some practices before COVID-19 that were struggling, that maybe couldn't have qualified for a $300,000 or $400,000 loan to renovate or remodel or expand their operations. And now, because of COVID-19, the unintended consequence is that they're going to get their hands on some money that the banks would not have lent.
I know.
So I think those are some interesting things. Yeah, I mean, so I think it's great. And of course, what I'll do as we get into this is I'll kind of talk to you about what we at Fortune are doing, very, very proactive. And we've put together a 90-day recovery plan, which is in week 2 right now. And of course, our mantra throughout the nation, but especially here in California, where we've done a great job of flattening the curve, our mantra is we got to get you back to work.
Yeah.
We've got to get you off of the sidelines and get you back in your practices, but we have to do it with a plan. And so I'm going to try to give you guys a good chunk of it. I think I sent you that PowerPoint, Bassim. Do you have the ability to bring that up when we're ready, or do you need me to bring it up?
When did you send it? I didn't
I sent it the other day, but I can grab it off my screen if you want.
Sure. Yeah.
When we're ready.
Maybe you could share it. Yeah. You could share it on the screen.
Sure.
Okay.
But those are some of my thoughts. And again, I can't emphasize enough one thing that you said. You have to have a great team of trusted advisors around you. I feel really, really bad for the single practitioner, independent dentist today who is trying to figure this out by themselves.
Mm-hmm.
I think it's like being in an envelope. It's a lonely place, and you don't know who to listen to and who not. Whereas, I think our clients, we're getting nothing but good feedback that, man, thank you so much on a weekly basis. You're giving us the strategies. We don't have to sort through 20 opinions. And part of it is just having a good coach. I mean, one of the first things that we had to do is we had to get every one of our doctors to that fifth stage of grief, which is acceptance, and accept what's going on here and make sure that the emotional fitness and the mental toughness is in place and the right filters are in place and the right focus is put in place.
Right.
We know that fear and anxiety a lot of times are created by the unknown, by uncertainty. So our job at Fortune is to give the profession as much certainty as possible. And the way you do that, of course, is by focusing on a plan, by doing things, by moving forward, by putting pro formas together. What's the rest of the year going to look like? We at Fortune, we've said this for years. I've said this for years when talking to dental practices, which is, remember, there's 3 types of work that must always be going on in a business. There's knowledge work, and out of that knowledge work is what I call project work. And those are the 2 types of work that keep any business, including a dental practice, proactive. Now, the 3rd type of work, ironically, is the one which helps you to get paid, which is work as it appears. And that's actually being in the practice, doing the dentistry, doing the schedules, answering the phones, billing the insurance company, billing, all of those day-to-day things. But the reality of it is when we're back to work, guys, we're in reactivity mode again. So one thing that this hiatus should have given all of you is this wonderful gift to go back and do some critical thinking about not just what the next 6 months will look like and what your team's going to look like and what your culture, your structure, your strategy, but also maybe some critical thinking as far as knowledge work towards what's the next 5 years look for you. But then it's also right now should be about assembling a correct set of projects to get you guys back better than you were before. Because you can't just work on your business. For the dentists who just completely checked out 30 days ago and kind of did complete shutdown, I think that's crazy. I mean, I know from a coaching standpoint, my 110 advisors throughout North America have worked harder in this last month, even though there's no dentistry going on, very little dentistry being delivered in this country. We're actually working double time, and we're asking our dentists to do the work double time. You guys have a ton to do. And this is going to be one of the single times in everyone's history of their lives that they're actually going to have the time to prepare for the future and get better. And I think there's going to be, just like anything else, crisis accelerates change. There was already tectonic shifts in dentistry before this came about. And we know that coming out of this, it's just the requirement for change and evolution will be quicker and quicker and quicker. And quite frankly, what I just told all of our organization this week is, look, the 20% of the top 20% of this profession are going to do really, really well. There are going to be opportunities everywhere. because the challenge and the concern is going to be in that lower 20% of the profession. These are the ones that were not evolving well before COVID-19. And a lot of them are not going to be able to make it back, unfortunately. There's going to be DSOs.
Yeah.
We're already seeing it. As of this Monday, I'm already getting on the news wire DSOs that are looking to sell off locations, sell off assets. A lot of these DSOs are being backed by private equity. Private equity is the first group of money that jumps ship in rocky times. They're looking to jump out of it. And there's going to be some great deals out there.
Of course.
And we'll talk about that a little later in the conversation. But, you know, it's what you focus on. And my encouragement is you all focus on the future. Here in Santa Clara County, we have put a date certain. In one capacity or another, we will have all of our dentists and all of our practices open on May 4th or sooner. And you have to put a date certain on the calendar, and you've got to have a process in place and a set of strategies to bring the team back. And you can't just flip the switch and bring the whole team back. That's not really realistic. So we'll get into some of those things. Bassim, I'm going to toss it back to you. You may have more things you want to cover.
Okay, great. Thanks, Bernie. Well, and like Bernie said, just like it took us some time to accept the situation that we're in now, it's going to take us probably, time as well to accept the fact that we're going to have to open it up. So, we need to start preparing our patients. We need to start preparing our team. We need to let people, our team and our patients know what are we doing in terms of getting ready to reopening. We definitely need to work on those things. All right, so the next thing I wanted to cover with you is understanding what the numbers mean. And again, there's no better time than now to start delving into your numbers and learning and knowing what your overhead looks like. And actually, we developed at Michael and Company, we developed an app that our clients use. It's called Practice Gauge. Let me share that with you. So Practice Gauge is an app that's connected to your QuickBooks Online. And what it does is it lets you see how your numbers are trending. So it does trend analysis. And on top of that, it also lets you compare your numbers to other practices. It's kind of like when you go to the doctor and get your annual labs done, right? They don't just tell you, oh, your blood sugar is, say, 100, but they give you what your numbers are, and then they tell you what the normal should be. And this is what Practice Gauge does. And the nice thing about it is, as your books are being updated, this dashboard is updated automatically with it. So it's a great tool that we provide to clients to let them know what their numbers mean and what the trends are looking like. For example, you could take a look here. This practice, with their dental supplies, their supplies as a percentage of their income has steadily been going down, and the gold bar represents, in all these cases or these overhead categories, the gold bar represents what the average for similar practices like theirs should be. So you could see here, supplies, they're almost there. Their lab fees are actually below the average. Marketing, they've got some room to maybe spend on marketing if they have capacity to fill. Their occupancy looks great. Employee costs, general and admin. And then we also calculate a category called net operating income. And net operating income is kind of like EBITDA, but on steroids. We don't think that the net income of a practice really gives a good picture, because sometimes, as we know, practice owners throw everything but the kitchen sink in their P&L numbers. So it doesn't really give a clear operating picture of what the operational results are of a practice. So what we do is we take the net income and then we massage it, and we back out all the elective items. We back out interest, depreciation, amortization, the doctor's salary, the doctor's perks. We back those things out and basically show the net income available to the doctor or the owner before all of these expenses. So that's what the net operating income. And again, we provide guidance on what that number should be, so that you could compare your net operating figures to what averages from other practices look like. And as we get more practices connected to our Practice Gauge app, we'll be able to narrow it down by zip code. We also have it narrowed down by practice type. So we have enough data already to provide different overhead categories based on specialty, for example. Then we know that employee cost is one of your biggest expenses. So if you're breaking down your costs on your profit and loss statement by function within your practice, like associates, assistants, hygienists, and clerical, we can also give you the statistics on how you compare to other practices within those subcategories. And then you could see it both in graphs, and we have also reports that can show you your collection trends, your collections versus net operating trends year over year, and what change occurred. And then again, for those who like to see tables and numbers, we do give you that picture. And then we show you how we calculate and how we adjust your income to come up with the net operating income that we discussed earlier. So that's one way you could learn about how your numbers work. And this is a great tool that you could use in your practice. Another thing that we wanted to also help you understand is understand how the PPP loan forgiveness is going to work, so that you could maximize the amount of forgiveness. So PPP loan proceeds can be spent and forgiven if you at least spend 75% of the proceeds on payroll, and then the remainder on rent, interest, and utilities. But what most people don't understand is that if you have laid off some employees, and if you don't bring them back by the forgiveness day, by June 30th, and again, I'm not sure how that's going to work when for some people, the forgiveness period is going to end before June 30th. So we're still going to have to wait for guidance from the SBA. But if you have any reductions on FTEs, full-time equivalents, or salaries before June 30th, and again, don't take that at its face value, because we could get some additional guidance from this SBA that can define this hopefully a little clearer. If you don't do that, the money that you spend on payroll and rent will be reduced. And I'm going to show you a different calculation that can show you the difference. If you don't bring back all those people by June 30th, what can happen to your forgiveness? So let me share that screen with you. So can you guys see this pretty clearly?
Yes.
Okay. So what I did is I wanted to show an example of a practice that has one doctor, one associate, maybe one family member that's an employee like a spouse, a hygienist, three hygienists, three assistants, one office manager, and two clerical staff, they spend about $60,000 a month on payroll, assuming that we maxed out the monthly payroll at $8,300 for the owner and the associate. So, and then they spent about $4,000 on health insurance, state payroll taxes, $1,200, and retirement about $1,800. So based on these assumptions, from the 12 employees of that practice, their total employee cost was about $67,000. And based on that, the calculated PPP amount, loan amount, was going to be about $169,000. So if this practice gets $169,000, and if over the next 8 weeks, they bring everybody back from day one, okay? From day one, they bring everybody back. But keep in mind, because 8 weeks is not the same as 2 months. So if you do get the PPP loan, say today on April 16th, that doesn't mean that your 8 weeks is going to end on June 16th. It's probably going to be a week earlier. So you have to look at your calendar and figure out what 8 weeks from the day that you get funded will be. And the SBA came out and said the maximum that any employee can make over those 8 weeks is $15,385. So in this particular scenario where this particular practice just brings everybody back to use all the funds. So the owner will make $15,000. The family salary will basically be twice as much, so $4,800. And same thing for the associate, $15,385. And then everything else is, again, twice as much. The total employee costs will be $135,000 in this scenario. Their monthly rent will be $10,000, interest $2,000, and utilities $2,000. So total qualified PPP expenses that can be forgiven would be $149,000. So with that, they would still have around $20,000 remaining from the PPP funds, and they would owe about $20,000, and they would have to pay it back. So that's assuming that they maintained all their FTEs and they did not have any reductions in salaries. Now, we did another scenario. We said, okay, well, you know, they probably will not need to bring back the associate or the hygienists right off the bat. And what if by June 30th, they just never brought them back, okay? What would the numbers look like? Because in that case, if there is a reduction in your full-time equivalents by June 30th, and if there is a reduction in salaries, then the amount of forgiveness will also be reduced. So again, assuming the same assumptions as this, except that we're doing it without associate hygienists, their total employee costs would be $74,000, and they still pay the same rent and utilities. So they spend $88,000 total, which this would be the amount that would be forgivable. But then, because they only maintained 8 full-time equivalents, okay, 8 full-time equivalents versus what they had originally pre-COVID, which is 12, that's roughly 2/3 of the FTE equivalents. So then what's going to happen is that 2/3 of the loan, or actually 2/3 of the qualified amounts that would be forgiven will actually be forgiven. So instead of having $88,000 be forgiven because there was a reduction in FTEs, full-time equivalents, that was not remedied by June 30th, the actual amount that will be forgiven will be $58,000. Therefore, the remaining loan on hand, the remaining funds on hand will be $80,000. But this is a scenario where they're actually going to owe more in PPP loan funds than they actually have on hand. And in this particular scenario, it's going to be to the tune of $30,000. So even though they only have 80,000 left, they will owe about 110,000 because only about 59,000 will be forgiven. So pay attention to the details. And like they always say, the devil is in the details. And make sure that you know what the rules are and play by the rules, so that you don't get a nasty surprise at the end. So I just kind of wanted to go over that quick example. And again, I wanted to signify that it's very important to remedy the FTE requirements before June 30th, and also keep your eyes and ears open as the Small Business Administration issues more guidance. But this is the law as of today. And again, what we've experienced is a lot of things can change overnight. And there were cases where, as I was speaking, you know, there was additional changes to the frequently asked questions by the SBA, or they would issue another final interim rules. So these things are changing all the time. So what we know today may not be what we know tomorrow. So just stay tuned and pay attention, and keep following the SBA website, and check with your CPA and your attorney and your consultant. Because I know, like in the background, I'm talking with other CPAs, I'm talking with other attorneys, I'm talking with consultants, and we're all trying to pull all the knowledge together. And this is evolving. But this is the law as we know it today. Bernie, is that your understanding as well of this?
I am coming back on. Yeah, that's my understanding. I have a little bit of a different strategy, though. You know, overall, I'm going to say, don't let the tail wag the dog. In other words, what our coaches are doing, our advisors are working individual plan for every one of our practices, because, you know, if you overthink the PPP and you try to game the system, I don't think it's going to serve you well in the end.
Yeah.
In other words, just bringing everybody back, like you show in your first scenario, is in most cases impractical. So I think it's really about, you take as much PPP money as you can, you utilize as much of it as you can. I mean, first of all, an owner doctor is entitled to that first $15,000 for themselves. If they have a spouse, they can double that money if they can show that they were on payroll before they started. You've got rent, you've got utilities, you've got medical benefits for the team. So you're going to be able to get creative and use a lot of that. And I think the most important thing I would say on this thing, because I don't want to belabor it, is that we don't even know how it's going to shake out once the SBA goes to start ratifying these loans. Yeah. You know, and we just don't know. They're making it up as they go, quite frankly. So you can't stand on ceremony, and I'm less inclined to worry about how much of the PPP money you use. I mean, that's like, for instance, what we're coaching, I'll show you in some PowerPoint, is if it's here in Santa Clara County, if we're asking all our doctors to get back in some form by May 4th, whether that be emergent care or, you know, more than that. And of course, you know, a big factor is going to be the PPE equipment. You know, how much of this is going to be available for them to actually be able to conduct business. But I'll get into all that too. But my feeling is, if we're really planning an opening day of May 4, and you've got the PPP money, whether you've got it or you don't have it, you need to start bringing a few key people, what I call transitional people or source people, and start bringing them back next week. Yeah. Next week and the week after. We've got to start getting schedules filled. We've got to get confirmations done. We've got to get stocking right. You've got to get all your PPE in place. There's a lot to be done over the next 2 weeks by our timeline. Absolutely. And yeah. I'm not going to have my clients making decisions based on PPP rules. Right. I'm going to have them make decisions based on how do we get back to full operations and profitability as quick as possible. And I'll talk about that a little bit.
Very good. Yeah, but at the same time, I think it's also important for people to understand what the rules are, so that they can,
I agree.
they know all the loopholes and figure out how to meet those requirements. And again, the exception to the rule in this is that you have to basically show that by June 30th, you did not have a reduction in full-time equivalents, and there was no reduction in salaries. And again, we don't know what that means. Does it mean that you bring them back just for one pay period to show that you met that requirement? And we'll have to wait for further guidance on that, like you said.
Well, yeah, and if you really think about it, if everyone is thinking about getting back around May 4th, you've got almost a full 8 weeks. Yeah. And if you've been bringing back some people before the opening, I think you're going to end up using most of it. And yes, it's important to know the rules and how to mitigate, but the key word here is mitigation, because it's going to be different for every dentist on the phone that's here today. And that's why you have to have a specific plan for yourself.
Absolutely. I couldn't agree more. And then I'm going to my last slide, which is basically your cash flow projections. You can't proceed in this environment without figuring out what your cash flow is going to look like. And it's not just going to be for a month or two, but you really need to develop it for the end of the year or the next 12 months. So first you need to develop your assumptions, and we are actually working on figuring out what those assumptions are going to be for some of our clients. Like, for example, we know that the day you open your doors, you're not going to be at 100% capacity of what you were before. So we're trying to figure out, okay, it's probably going to be, we're going to start off at a fraction of what we were doing before, and then hopefully, it's going to ramp up. But are we going to have the resources and the cash to help us initially as we're trying to ramp up? So cash flow is going to be critical. It's going to be important. And like I always say this, cash is the fuel that practices and businesses run on. So I was going to show you some examples, but I think for the sake of time, I want to give all the time to Bernie, and also we want to have some time to answer some questions. So with that, I'm gonna hand it over to Bernie.
Okay, and what I'm going to do is I'm going to bring, if you can let me share my screen, I'll bring up this week's PowerPoint from our 90-day recovery plan, which I think is highly, highly valuable for everybody on. So if you can allow me to share screen.
You should be able to if you go to the bottom and click on that share screen button. As a panelist, you should be able to.
It says new share. It should say new share.
It says I cannot while someone else is sharing.
Oh, okay.
So
I'll stop sharing.
You gotta get rid of yours first. There you go.
All gone.
Technology. Let me go to.
And I just wanted to mention, everyone, while we're waiting, like, for example, we're able to work full-time from home because our phones are digital. We're all on Google. So we got everything, and we have remote access to our desktops. Your IT professional is considered an essential worker. So you can get this all set up so your front desk person can work from home, answer phones, and access the computers at work. So there's a lot of stuff you can be doing with these PPP loans from home if you can get it set up.
Yeah, absolutely.
Yeah, that's very true. The other thing, while I'm bringing this up, let me just also say that as the cash flow analysis is really important, because what we see, we don't see the major cash crunch being right then and there when you open. The the time that you're going to have to really, really be careful. Okay, how's that screen look? Do I have screen?
I don't know, it looks like it's zoomed in too much.
Got some other kind of disturbance here. Can you see that green box on your screen?
No, I only see, no, I don't see the green box.
Okay, so you do see the practice recovery acceleration plan?
Yes.
All right. Well, I'm gonna go off of that.
But
Can you see that?
It's zoomed up too much. So let me see if I can start it on my computer, and then maybe I can. Because I think I just let me double check that really quickly.
What does that look like right now? I'm going to probably have to hit stop share then.
Yeah, that's fine, and I'll start it on my.
Why don't you bring it up?
Yeah, I'll bring it up, and you just tell me when to move to the next slide.
That'd be great.
Yeah, no worries. But
and while you say, while we don't want dead air on this call, so while you're bringing that up, just some things to think about. First of all, if you're following, one of the things we showed to all of our doctors this week is really where that COVID curve is. And, as most of you know, California has done a great job compared to some of the other hotspots in the country. There it is. You got it up. Now maybe you can go full screen. So we really have to, there's been some challenges, I think, with the way the COVID-19 has even been reported. I'm not so sure the press has done us any favors. I think that they have sensationalized it. I think that they have politicized it. I think they have created a lot of pandemonium that maybe didn't need to exist. And the reality of it is the facts don't support the pandemonium. So it's important that we keep a clear head on this thing. The reality, I looked this morning in California, as of this morning, there have been 20 people. We've had 20 deaths out of every 1 million people in the state. We'll lose far more than that to suicide, to drug overdoses, to automobile wrecks this year. Far, far. Even the plain and simple flu is going to take 60,000 people in the U.S. this year. So it's important to keep things in context. Not that it's not highly contagious and that it is a serious problem, but I think it's important that you keep your mind about you. Okay, so let me before I get into this, before you get into this, what we did right out of the gates as an organization at Fortune is from day one, we wanted to make sure that we're working on a 90-day recovery plan. So what you're seeing right here, you've got week 1 here. You don't have week 2?
Natalie sent me week 1.
Ooh. All right.
Well, I don't know. Is it all on the same slide deck?
Could be. Well, I'll tell you what, we'll work off this one. This is fine.
Yeah, okay.
But so anyway, what we did is, and by the way, the reason I'm explaining this is because it's available to everybody who's on this line today. In other words, what we did is we said, we're going to put together a 90-day recovery plan, which for all of our doctors throughout the country, what they're now receiving is they're receiving a weekly PowerPoint presentation. The one that's up on your screen today was week 1, which was last week. We've since now broadcast week 2, and I'll talk a little bit about what's in there as well. And then along with that, we're giving them a weekly set of instructions and a checklist along with that, each of our coaches is conducting a one-on-one weekly coaching call with every doctor that's in our client base. And it was really, really well received, to the point where we said, as a national company and as a leader in this profession, we wanted to make it more broad-based available. So what my leadership team did is they came up with a package. So for any of you who are interested in being part of this 90-day recovery acceleration plan and having a coach with you for the next 12 weeks, we've made it available. We've also made it very affordable. The whole program for the 12 weeks is $49.95, but all we're telling the doctors is go to our link at our national website, fortunemgmt.com. You can sign up for it, put a credit card down for $9.95, and we will settle up the other $4,000 with you on the back end of your recovery, like 12 weeks from now. And it's been set up so that it's almost like a Netflix series. Even if you got on late, you're still going to get all 12 weeks. It's going to include a lot that's going to bring you back to full strength. And we're pretty proud of it. So I'm going to give you an example here of what we did in week 1. And then I'm also going to kind of talk to you about what's going on now in week 2. So go ahead and advance that. So one of the things I'd like you all to think about is we're going to use some sports metaphors here, specifically football. If you think about it, on a football team and in a game, you've got 3 different squads that are working. You've got a defensive squad, and if the defense does a great job, then that allows the special teams to come onto the field. And their job, of course, is to set up the offense to go and score. This COVID-19 game plan for 90 days is very much set up that way. So go back to those boxes there, Bassim. Can you reverse it one?
Yeah. Sorry.
So right out of the gates, and I mean, even before we started the 90-day program, we said, look, these are 8 defensive measures that absolutely everybody on this call today should have already done. We should have went to temporary employment with the majority of our staff. We should have applied for PPP money on the first day. We should have contacted our lenders for deferments of any payments if you did have practice loans or other equipment loans. We also really emphasized that you contacted your landlord when it was appropriate to see what kind of deferment arrangements you had there. We also, and we're still sticking with this, we still believe you should be putting interruption of business insurance claims in. Now, the insurance companies are probably going to deny those claims, but that's not going to be the end of the road. The reality of it is there are a lot of law firms right now studying how to pierce that, and they've got the U.S. government on their side for the fact that it is a 50-state national disaster. So I would put a claim in with your insurance agent either way. The other thing we said was if you're a doctor who is a C Corp and you're paying yourself as an employee, you were eligible for unemployment. We also said go and tap your lines of credit. Make sure that you put that money in your bank. You can always pay off the line of credit later. And then we said pay no taxes. So we know the government said, look, you're not going to even have to file your federal income tax returns until July 15th. They also said no payroll taxes. And you needed to decide on your own, even things like your property taxes that were just due on April 10th. I'm seeing that there's a lot of counties out there where you can go online and you can ask for forgiveness of any penalties or interest if you even pay property taxes late. So those were 8 defensive measures every single dentist should have did. Let's go to the next slide. And then develop it. You left it. There it is. Then we wanted you to, and this was week 1. We have since gone deeper into this, but at least a 90-day cash flow plan. I'm not going to spend a lot of time on this because Bassim, you did a wonderful job on that. But here's what I would say. I'd go one step further. Now what it should be is a cash flow a cash flow plan through the end of 2020, but I would also make sure that it's not just the cash flow plan. It's got to be matched to your business plan. Just like at Fortune, we have every one of our teams start the year with an annual plan. How much they're going to produce, how much they're going to collect, where their staffing needs going to be, what's it going to take for our team to bonus, where's the EBITDA going to be for the practice itself. This is all going to have to be redone for the second half of the year, and then it's got to be matched to what the cash flow plans are as well. Next slide.
And Bernie, just to let you know, I think I just got the week 2 right now. Natalie just sent it to me.
All right. Well, you know what? Then I'd like to see. I will cover this slide because I think it's valuable.
Okay.
Because there were also some other resources that I want you all to consider. First of all, what are your cash holdings on hand before this all started? Second thing is you got to remember that a lot of you have the ability to do business or home equity lines of credit if you needed it. See, all of these things are set to give you financial certainty. And you need that. You need financial confidence. You're going to need that for the next 12 months. And then the other thing, too, I want to remind you, and Bassim can kind of comment on this, but the government has also opened it up where you can go tap your 401ks for $100,000, penalty-free, and have, I think it's up to 3 tax years to replace the money with no consequence. So you've all got, I shouldn't say all, but most of you have some really nice financial certainty that you can create through a lot of these other things. Does that make sense, Bassim?
Totally agree. Yes. And I'm going to be covering this on Monday.
Good. Now let's go into, this is the slides that I wanted to start with. This is actually week 2. So this is what was given to all of our doctors across the country. And what we started with was just a little bit of commentary about where the curve is in your particular area. And if you go through there, Bassim, I think we've got a California breakout on there. Maybe not. But here's what we know. If you go to that website, we are not predicting any bed shortages at all. And quite frankly, like United States, they're showing that we hit our peak April 11th. I don't know if that's completely accurate, but I know that here on the West Coast, there is 0 bed shortages. There is zero shortages in any area, respirators, things like that. So I think it's just important that you know where your statistics are for your area. And like I said, this is a call. Who's on the call today are mainly all Santa Clara County dentists. I got to tell you, we're in good shape in Santa Clara, which is why I have the confidence to instruct all my coaches, all of our clients, that we need to prepare to be open in some regards by May 4th if we've got the PPE. Let's go to the next frame. Next. So the other thing, I mentioned this earlier, but I'm going to re-mention it, and that is challenge yourself as to where your filters are. In other words, we know in life you get what you focus on, what meanings you're going to apply to it, and what you're willing to do despite the fear. And so one of the things we thought was really important about, the way we're coaching, I mean, again, I said it's ironic that in a time when we probably have not delivered much dentistry in the profession in the last 30 days, we've asked our coaches and our clients to work double hard on the future and on the opportunities and how the rebound's going to work. And there's going to be a ton of opportunities. So we'll get to that too. Next frame. So this is what I was talking about. This is a great metaphor for all of you. The defensive posturing, in my eyes, is pretty much over. In other words, you've done what you've done. And hopefully you did apply for your SPA money and your PPP money, and you've laid your people off, and you've done the things that we asked you to do 30 days ago. Now, where we're at right now and where you should be right now, you should be in special teams mode. This is the transitional mode that should probably start happening for the next 2 weeks starting Monday. And I'll talk a little bit about what's there, so that ultimately for here in Santa Clara County, acceleration phase is going to probably start the offensive formation. So it's good to have a mindset of where you want to go here. Next frame. This was another thing that we asked our doctors to do on day one. Lord knows you've all got some time on your hands. So we challenged every one of our dentists to make 25 patient calls a day, to send out 15 more emails a day, and to send 10 thinking of you cards. Now, if you did this, let's say you're a single practitioner, what that just did is that just sets you up to have 50 patient contacts a day. If that was done for 30 days, you could cover a patient base of 1,500 patients. And obviously, if you had associates, you could dole some of that out to them. You could have some of your other team, key people on your team do it. But we feel that the strongest connection, let's face it, guys, the most valuable asset that you have in your practices as we move towards reopening is your patient base and the trusted emotional connection you have with every one of your patients. And now is a time for you to step up as leaders in the community, call people and say, hey, how you doing? I just wanted to check in with you. I wanted to make sure you're okay. How's your family? And I want to make sure you know that we're here for you. And here's my cell phone number. And if there's any emergencies or anything I can do for you, give me a call. Here I am. I care about you. We're going to play the long game here. We're not playing the short game with our patients. So I think this is something everyone could get going on immediately. Next frame. Also, we are suggesting and helping our teams to do a weekly virtual team meeting, just like these Zoom calls. You should be doing one of these every week with your team. And I think that there's several topics, but even before you get into the topics, what we're seeing with our teams is as they get on these Zoom calls, we give them 5 or 10 minutes of that Zoom call just to say hi to one another, to share a laugh, to share a cry, to ask them what are they most grateful for, and what's a great thing that's come out of this little life experience for all of us. And so many of the people on the team, they haven't seen each other since shutdown. And it's important just to give them the ability to connect and bond and make sure that the culture of your organization is still there, and that it's also a chance for you guys to lead as doctors. You know as well as I do, in a time of crisis is when real leaders have to show up. And we're seeing that, from our end at Fortune. I'm seeing it personally. I mean, we are taking calls from other industry leaders. Fortune is fielding calls every day from the major suppliers, from the major manufacturers, from the banks, from the law firms, from the accounting firms, looking for direction, and it's called leadership. One of the things I'm most proud about is over a 30-year period, Fortune has really stood that test of time. And it's good to have people around you who have lived through other crises. People that maybe have a little bit of gray hair. I mean, I was joking with Fred Joyle. I did a webinar with him this morning, and I said, I go, you and I can relate to this, but I remember back in 1984 when Jimmy Carter had interest rates at 20%. I remember 87 when the stock market lost half of its value in one day. Now, we didn't have any of that this time around. I remember in the 90s when we had some recessions there. I remember 2001 and 9/11 and what that did as far as an economic turndown. I remember the dot-com bust and the economic implications there. We certainly remember, most of us, the economic meltdowns of the subprime in 2008, and now we have this. So, after a while, it's just another one of those. And seasoned entrepreneurs and seasoned leaders know how to bring you through winter. That's what good coaching will bring to you. You know, I told Fred this morning, I said, you know, if you really think about it, if you're a younger dentist on this call right now, in other words, you started your practice after 2008, and you've had this wonderful 12-year run, at least I hope it's been wonderful for you, you've experienced some really good financial growth. And we've lived through, just of late, one of the strongest economic periods in America. And now you've hit a wall. And for some of you, you know, there's major fear. You've never experienced this. So when Bassim says, hey, get a team around you of experienced professionals who have lived through these things before, I mean it. And I'm not, this is not a self-serving conversation. It doesn't have to be fortune. But get some people who know how to help you to get through with some certainty. But again, some things that we're having our teams do on a weekly basis is we're having the doctor tell the team all the action items in a defensive posture and now in a proactive posture that they've been doing. We don't want the team thinking that the dentist is off on their private yacht or sitting around their swimming pool. They're working. They're making sure that team has a practice to come back to. That's hugely important that you step up and deliver that message. Second thing that they're talking about this week for sure is discussing opening day and what that's going to look like. And also reminding the team of the powerful why of why your practice exists in the first place. You know, you've all done work with Simon Sinek's books and Tony Robbins, and we're all talking about a power of why. This is an important time to get back to it. Get back to your power why and why dentistry can't sit on the sidelines, and that we are an essential profession, and that we've got to have a company there waiting for the patients, because the patients are they're gonna come back, just a matter of time, but it'll look differently. The other thing is, talk to your team about what we need to change. What do we need to do to evolve into a new normal? It's not going to be the same when you go back as how it was when you left. You know, one of the things that, you know, I know for sure is that your patients are going to require a lot of time on the phone when you're reappointing them or confirming their hygiene appointments. They're going to need a lot more time on the phone. I average 10 to 15 minutes per call with every patient who you're putting back on the schedule. So you've got to allow for that. Discuss a game plan. I'm going to give you some of that right now. But then also childcare options. And what is the plan for the office in regards to that as well? Because, you know, and by the way, every one of you dentists should have an individual one-on-one call with every one of your employees. First of all, you got to find out, are they ready to come back on May 4th? Are they okay? Have they not contracted the virus? Do they have child care available to them? I've seen a lot of our teams already. They're already talking about child care options where one person on the team may provide child care for the whole team's kids on a weekly basis. So there's all kinds of creativity and individual thought processes, but I highly, you know, acknowledge, get a Zoom meeting going every week from here on out. And I can go on and on about this slide, but I want to get it all to you. Let's go to the next one, the next slide, Bassim.
Stuck.
Can you move it?
Yeah, I did. Okay.
There you go. This is going to be huge as you get ready to open. Is you got to determine your stock. Now that's just not supplies, but it's also, you know, what projects, project your need, project that there may be some shortages, and start ordering accordingly. Go to the next frame. I kind of go on to this a little bit more. So here's some things to consider. One of the things we know, there's a lot of noise going on from the CDC, from a lot of your state dental associations right now, the ADA, all about the zero pressure treatment rooms, things like that. That is going to be an evolving saga. And, you know, for any of you who are practicing with open bay dental practices, you're not going to be able to do a lot of those things. And a lot of this is going to be you putting out a really, really good perception to your patients that your practice and your environment is safe, that you guys are trained in infectious disease. And so one of the things I put up here on the screen is a basic air purifier system. You know, you can go to Costco or buy these online for probably $200 to $300 per unit. These will purify a normal operatory about once an hour. So, but it'll turn an operatory over as far as the whole air quality in 1 hour. I think even though they may not be, you know, what the CDA is going to come out and profess, it's great for the internal marketing and assuring your patients. Also, the proper gear, the proper shields, the N95 masks, all of those things. And remember, my feeling is you've got to put your pressure right now on your major suppliers, whether that be Henry Schein or Patterson or whoever else you're using. I think that you need to be putting requests in, and if not, you need to be getting creative. You need to be going to Amazon, but you've got to have enough PPE to be able to open, and that is going to be a concern. So these are things that you and your team should be working on right now. Next frame. Here's another thing that all of our teams are doing, and that is they're making sure that they're adjusting their fee schedules and reviewing their services. So for all of our clients, what we do is every year, every January, we give them the latest version of the NDAS by ADA code, which really tells them where their fees need to be in their particular zip code, whether they're at the 80th, 90th, 95th percentile. Now, we have always professed at Fortune because of the quality of the practices that we cover. Percentile. So if you have not done that for the year 2020, some of you have been remiss, get a hold of us at Fortune. We'll give you the NDS report. Go to work on adjusting up your UCR fees, and that's just good business tactics. But let's go a little further.
Bernie,
what you may
you're
not
cutting
know
up.
Is that there is also a part of the state law is there's something called the Uncovered Procedures Act. Uncovered Procedures Act means that there are certain ADA codes or customized codes on most of your software. You use a 9,000 code, and you would create some new codes. One of the things that we're coaching our practices is that we should have a surcharge for all the sterilization and the equipment and the PPE that we're going to have to invest in to treat our patients today. So the number that came about as a consensus this week, it's subject to change, is we feel it's like at least $12 per hour per operatory. So that means that on everybody's invoices and walkout statements and all the patient billing, there's going to be a $12 surcharge. No different than if you go into San Francisco and have a dinner at a restaurant when they open back up. If you remember, City of San Francisco has made mandatory health care benefits for all their restaurant workers. And there's a surcharge right on the bottom of your dinner bill. This is no different. And people are going to understand that because of COVID-19, it now costs you more money to operate. You've seen it with the airlines, with oil surcharges, things like this. So the same thing's got to apply. You've got to learn how to put customized 9,000 codes. And I mean, I did the math the other day. You think about this. If you were getting an additional $100 per provider per day, which would be $12 times eight hours, and let's say you had just one dentist and two hygienists, that's $300 a day on a 20-day work month. That's $6,000 in additional revenue that you absolutely are deserving of. So, I'm into these things. I'm kind of blowing through a lot of these things. These are all beg for deeper conversation. get a hold of my local fortune coaches in Santa Clara. We've got a whole team of them. Reach out to them. We're here to support you guys. Now, you got to remember, Santa Clara County, I think, is in a good position with us at Fortune because it's our national headquarters. We're based here for the whole country, right in San Jose. So I absolutely was grateful to be able to come and support Bassim today because it's my home too. You know, the other thing too is this would be a great time for you to be taking a look at in-house membership plans. Now, we at Fortune for the last 5 years. 5 years ago, we developed for all of our clients an in-house membership plan. Ours is called Plan for Health. You can get more information on our website. But you have to remember,
Bernie, can you hear me?
Coming out of COVID-19, there is going to be a lot of people in the workforce who are not going to be brought back by their employer, or they're going to lose certain benefits, or they're going to be in transitional phases. This is a really good time to be promoting in-house membership plans. The other thing that I'd say to that is for a lot of our offices who already had membership plans in place, this was a real lifesaver for them over this last 30 days because they were able to do recurring annual billing to some of their patients. So there's a lot there. Let's go to the next one there. Accounts receivable.
Bernie, can you hear me?
Going the wrong direction.
Bernie, can you hear me?
Go forward. Can you guys hear me all right?
No, we can't hear you.
You can hear me?
No, we cannot.
All right, I think my earbuds just died, so I am now on good, reliable cell phone. Move those frames forward.
Let me see.
You went all the way backwards. You got to go forward.
I know. Can you hear me now, though?
I can hear you fine.
Okay, very good. So let me go back to the right presentation. Is this the right presentation? No, right?
Yeah, no, now you're back at week 1. You need to get to the one you just had up on the screen before you started going in the wrong direction.
Sorry.
Week 2.
I was trying to alert you that we were losing the sound.
Oh, okay. Yeah, yeah. So tell me get the week 2 back up, and then tell me what you didn't hear, and we'll proceed by cell phone.
We didn't hear most of this slide. The fee schedules and patient service review.
All right, so I'll go back over that, but you go ahead and get that back up. Here's what I said. There's a couple key points I want our audience. Yeah, that's the right set of slides. Couple key points I want our audience to be able to take advantage of. I think you guys heard me there. Okay, stop right there, Bassim. So what I said was, Bassim, did you not hear any of this?
I think it was in and out. So
okay. Well, what I'm saying here is I think you all need to adjust your fee schedules. You all need to develop these 9,000 codes for sterilization. Now, the strategy I'm going to give you guys today is $12 per visit. We've done the math. It's probably about $12 to $15 per patient in additional cost to treat them once they come back in. So I think you need to develop a 9,000 code. It's part of the Uncovered Procedures Act, which absolutely exists here in the state of California. The insurance companies may not pay, but they can't tell you can't charge for it. Delta cannot come back and tell you that you can't charge their patients for these surcharges and these 9,000 codes for sterilization. So I would get very comfortable with those. And then the other thing I said, of course, was in-house membership plans. Now, we at Fortune have our own plan for health. We developed it 5 years ago, which is an annual membership plan. It has really been a game saver for a lot of our practices who have, even during this shutdown, have been able to continue to enjoy some recurring revenue with annual renewals to their patients that are part of members. But here's where the opportunity is moving forward, is that you're going to have a lot of people returning to the workforce And you're going to have some that are not going to return to the workforce, and they're going to lose certain benefits, or they're going to be in this transitional phase of their life or in their employment. This is a great safety net for you to offer those patients. Tell them, hey, we're going to make sure your dental care stays intact. We got a wonderful, very affordable membership plan that can actually help you to grow your business. So these are the times when you turn negatives into positives, and fee schedules and membership plans are part of our moving forward process. Let's go to the next frame.
Okay.
The other thing is accounts receivable. Now, most of you, hopefully, you're looking at this little, blip in time as a way to really, really put a dent in your accounts receivable and really clear the pipeline out. And what we're suggesting is, look, if you dentists have done a diligent job of staying in relationship and in communication and making those daily calls to your patient base, then you're going to be able to have conversations about people who still owe you money. Clearly, we should be collecting all of our insurance money, outstanding insurance claims. This is a chance to clear that pipeline. But also there's some unique letters that we've developed. If you go to the next frame. So this is just a great example of cleaning up your accounts and what we call it spring cleaning. And basically, there's some nice supportive language to the patients. It says, if you're temporarily laid off or a business owner, we're happy to extend interest-free terms and that will commence after this is over. And we're also asking people that have not been affected by this COVID-19 if they could make their accounts current. But I think it's a great way for you. You'll have a great reason to have people call, letters to go out, and to try to actually reduce your accounts receivable. A lot of our teams are even issuing $25 courtesy credits to patients if they're willing to clean up their bill ahead of time. So there's all kinds of things that you can do to make yourself look like the good person in the community that's supporting everyone else's needs. Let's go to the next frame. This is also a time when you really have the ability to kind of think like a startup dental practice. In other words, one of the things I've said to people all over the country for years is the way I run Fortune Management as the CEO is every year we treat our company as if it's a startup. And obviously we're 30 years in business, but it's a mindset. And the mindset is, how can we recreate a business, and in your case, your practice, that if you went out and competed with last year's version of your practice, you'd put it out of business. In other words, how can you be better than you used to be? And part of that is while you're off, you have the time really to evaluate your team. And, here's the thing, and I'm going to say it delicately, but there are certain people that may have been brought into your practice who had just came on in the last 90 days, who you're still concerned about if you made a good hire. There may be people who are close to retirement age that, have been with you for a long time that, maybe this is going to accelerate that conversation. But here's the practicality of my conversation here is that if you were a startup, in other words, we have a whole startup division at Fortune Management. And when we put a young dentist in business to open up their doors for the very first time, it's not like we bring a team of 8 people in there. We bring key people back in there first. So clearly, even if you're a $1 million practice here in Santa Clara County, you've got to think about who are your special teams, who's your off-season team that you need to bring back first. You need to bring back scheduling coordinator. You need to bring back financial coordinator. You need to bring back maybe one key hygienist to start working on the schedule. You've got to have a game plan to bring them back in waves. And that's why, Bassim, I said earlier, don't overthink the PPP money, because you cannot just flip a switch and take everyone off unemployment. I'd love to tell you you could, but you can't. and it's not practical. But what you do need over these next couple of weeks is you need special teams, you need an opening day team, and that might even be a conversation with associates. You know, one of the things that the PPP has allowed is for you to, you know, if they are an employee, a W-2 status, you know, you're getting PPP money for almost $8,000 a month for each of those associates. Maybe you're working special return engagements with them as well. But to think that you're just going to come back with every employee on day one, I think that's not a good plan. And I think ultimately you're going to bring people back as they're ready to come back. You know, the other thing I said earlier is there's going to be some team members who are not going to be comfortable coming back, or they're not going to have daycare, or, you know, they're worried about getting sick by patients that are going to come in. We're seeing a lot of that already. So you've really got to have these one-on-one conversations, but I think you as the CEO of your business, you have got to do some critical thinking about, you know, what are we going to need to produce the amount of dentistry that's going to be there for us in those opening weeks. You know, the conversely to this is you all know there's going to be a lot of patients, especially your older senior patients, who are not going to want to come in for prophies and regular exams right now because of their fear factor. And that's why I say you've got to have a team of people really, really trained with scripts on how to get them back in, how to put them at ease. But again, you know, you'll come back at maybe 30, 40% as far as productivity. And then, you know, what we're doing with all our teams is we're going to grow through that cash flow analysis and through the plan for the second half of the year to restore you all the way and beyond. And I think that's what's got a lot of our dentists feeling really good right now is there's a solid, rock solid plan. They know they've got the financial wherewithal to be able to bring it all the way back and kind of come out of this unscathed and maybe even take advantage of some opportunities. But definitely some conversations all around what team you're bringing in and when you bring them in. You know, I would also go to the next frame for me. You also have got, this is where our, you know, we have taught for 30 years at Fortune scheduling to goal methodology. Well, guess what? That's going to look a little different here over the next 90 to 120 days as far as what a doctor's schedule going to look like. What is a hygienist schedule going to look like? We're going to start recommending that the hygienists are starting to make the calls to fill their own schedules, and you're going to need to bring the hygiene team back in phases. If you've got multiple hygienists, you know, 2, 3, 4 hygienists, you got to bring them back and fill one column at a time. Same thing with the dentists. Single column booking right now until you can, you know, you can really add another column or until you can bring an associate back. This is also a great time to work with our shadow scheduling that we teach on the hygiene side, and also a good time to be playing around with assisted hygiene so that you can bring maybe an additional assistant back. So there is a game plan. It's got to be customized for each and every one of you, but you know, we are happy to assist each of you with putting that plan together on a weekly basis. But again, you're going to feel much, much better if you have a thought out plan of action steps every week to get back to full strength. I'm sure I'm spurring a lot of questions. We'll take those at the end, but let's finish this PowerPoint deck. There's not much left to it. Next frame. So deliverables this week. This was week 2's challenge to every one of our doctors throughout America, and that is start writing collection letters. We've given our teams some examples. Update your fees. Start working on those 9,000 codes for COVID-19 PPE charges. Virtual team meeting, and also start working on scripting for your team to start talking to your patients to get them in. Those are the 4 action items this week that we want people working on. Next week, I can tell you in advance, we're going to do a deep dive into one of your favorite subjects, Bassim, which is the cash flow analysis. So we're going to give some very, very high direction on that. We're also going to give more high direction on scheduling and how to bring people back in that way. We're going to talk more about the scripting next week. So we're already working, we're deep into all of our materials and action plans for week 3. And again, we're going to bring this all the way through 12 weeks. What's the next frame? This is a great Chinese symbol, crisis, which equals danger and opportunity. And what we're coaching every one of our dentists in America today is to understand that, yes, there are a few financial dangers and health risks to getting back on the train and getting your business back. But I got to tell you, there is a ton of opportunities that are going to exist. I said that at the beginning of our call. I said, you know, for the well-run practices that have a game plan, that are following a 12-week recovery program, that really have financial confidence, that really have good leadership in place and good coaching in place and good advisors from their CPA and HR and things like that, you guys are going to do well. If you're in that group, that top 20, 30% of this profession is going to come back stronger than ever. Opportunities will be everywhere. And I also comment on the lower 20% too. I mean, these are some practitioners that are really going to have to think about how they're going to make their reentry. And, you know, this is a shout out. Fortune can help you on that stuff. If you are a later career dentist, if you are someone who was struggling to evolve before this all started, or maybe you've got a lease challenge coming up with your space, or haven't been able to put new technology, we've got some solutions for you. Reach out to us, reach out to our coaches. This is a great time for the whole profession to start taking advantage of what we call economy of scale. And we can create win-wins. I think there's one more frame. Yeah, and that's the final frame. I've really finished a lot of my live seminars throughout America for probably the last 25 years, reminding people that whatever we send out in this universe is what's going to come back to us. This is a perfect time right now for us to all believe in that, believe in the law of attraction, believe that you get what you focus on, believe that the universe will give you whatever you send out, but you got to send out good things. And some of the things you have to send out is that you're confident that you in dentistry are there to serve. And that's really the operative word right now. How can we serve? How can we help? And so that's why Fortune's, you know, we're going to continue to do what we're doing, and why after we developed this process of this 90-day recovery plan, we said, look, we have always stood for private practitioner dentists and dentistry in this country. And so we need to lead with our giving hand. And so this recovery program is out there for everybody who wants it. I want to appreciate the fact that, Bassim, you're allowing me to, you know, put it out there for you guys. But we're here to serve. And for some of you younger dentists who are looking to grow, this is going to be an amazing growth period. We're even getting, you know, we're getting letters on the news wire. We're getting emails daily now from, you know, there's failing DSOs who are going to take a big hit in this climate right now. We're already seeing DSOs who are trying to sell off locations for pennies on the dollar. We're seeing private equity who backs a lot of these DSOs to really want to cut and run. So for you guys on the private practitioner side or trying to grow yourselves, you've got a hell of an opportunity here coming up through the end of this year if you have a strategy and a plan. And I think at the end of the day, guys, it's emotional fitness, it's mental toughness, and making sure that you have people around you who will keep you grounded and make sure that they'll tell you where your blind spots are. So it's been a pleasure. I think, Bassim, at this point, let's open it up to as many questions as we can take, and any way that I can serve while I'm on the line.
Great. Well, I've already answered some of the questions by typing back the answers in the Q&A section, but we have about 8 questions right now that I thought maybe they were good to kind of share with everybody. So the first question says, what happened if we are funded right now for the PPP, pay staff for 8 weeks, and then lay off again if still closed after July 1st? Does this cause us to lose our forgiveness of the loan? I'm hearing because of B of A requires you to keep staff through September 30th.
Well, I will tell you, here's my opinion. You may have a different one, Bassim, but I can tell you that B of A has made up some of their own rules there. And that's ironic, seeing that B of A has been about the slowest at getting any PPP money out. So I don't know, maybe it's a mood issue. But again, I'm going to go back to what I said earlier, which is, if you are in a proactive mindset and you're really going to put a date certain to be open in some capacity by May 4th, I don't think we're going to have a real issue. And of course, what if we really believed something different? What if we believed that we have May 4th through the end of June to ramp our business back up so we can have everybody at full strength after June? I think that's the more proactive mindset.
Right, and that's the right mentality and mindset. I think, I mean, we have to go also back to statistics, and we have data, and I think I shared this with you on the last call, but we have data that shows that in California, roughly close to with the traditional solo practitioners, the average practice is producing roughly about 19% of their pre-COVID production. These are
right, which is mostly emergent care. Yeah. I mean, we have a lot. I mean, we've got some practices right here in the Bay Area that have been open almost every day, taking care of emergent care and doing, and really, there's a broad interpretation of that conversation right now. But then I've also heard statistics about how the DSOs are still functioning at 40%. Right. I don't know that I'm buying into that, quite frankly. I think there's some bad data there because, we follow the DSO sector as well. And I can tell you that there's no way that we're not aware of any 40%. I know Pacific Dental Service, which is very prevalent here on the West Coast, they have done major layoffs. So the big operators are potentially in a worse position than the single operators who can be smart, quick, and flexible on their management and recovery decisions.
Yeah, and again, regarding that question about B of A, I just looked at a promissory note today for a client, and it did not have that language. So I think maybe early on they were including that language, and maybe they removed it. But I think finally the SBA dictates what's going to be forgiven, not the bank. So.
Well, absolutely. I mean, come December 15th or whenever you're ready to ratify, it's not going to be the bank that's going to ratify it with you. It's going to be the SBA that's going to ratify. So that's why I say I'm not putting a lot of weight in what the banks, that's why I say 84% of the PPP money that's been sent out as of yesterday was sent by smaller community banks. Reason being is these CEOs of those particular community banks, they saw this as a huge opportunity to make 5 points on every transaction.
Right.
So you think about that. That was smart. And some of these bigger banks are really tripping all over themselves is how it's really turning out. What other questions do you have?
Another really good question. It says, what if employees don't want to return?
Let me comment on that. That's exactly why it is important that the doctors, the employers, are in weekly communication with their employees. And they got to know where their heads are at and where their mindset is and where their child care is. Now, again, there could be all kinds of situations, right? It can be, they don't want to come back because they're fearful of getting sick, or maybe they're older in age. You've got a lot of people out there in dentistry in their 60s who are still working. There's a lot of dentists who are in their 60s who may not feel comfortable. So it's going to be different for every practice. There's also going to be the child care issue. There's also going to be the fact that some of them may be sick. So there's going to be a myriad of reasons. Now, one thing you do need to remember is that's where the Family Leave Act is going to come back into play. Because if one of your employees, once you do have your doors open and your employees do want to execute their rights under the Family Leave Act, they are going to be able to do that. And that was one of the other reasons for the PPP money. And what I'm suggesting is you get a hold of HR for Health, Alia Romkian's team, and get some real straightforward HR advice on that. I heard you say at the beginning that Ali's going to do a program on next week. And of course, we're all friends and we all work together. So I would really rely on them, because that Family Leave Act will allow some of them to take more time off. And quite frankly, it might be a win-win. You may not have the need for that second or third column of hygiene right away. Yeah. So good question, and there's a way to handle it. Next question.
And again, I mean, the second part of the question was, how do you utilize PPP? And I think you addressed that. But again, don't worry about that, because even if you don't have the PPP and they still, request the paid family leave, there are other things that may be used. And again, there is a credit available if you did not get the PPP that you could use to get your money back on funding that paid family leave. The next question.
Yeah, and just to cap that off, let me just say again, the focus for all of you on this line has got to be on getting your top line restored. Mm-hmm. Get your top line, get your productivity and your collections restored, because that's going to cure all the ills. It'll help you make the decisions on bringing people back, right, and who's not coming back. I mean, we've got some very, very proactive teams that are already thinking about, well, if I've got reduced payroll for a couple of months and we're using the Fortune bonus program, can we actually create a bonus system with a lower payroll that makes it easier for the people who are back, our A players, to actually make more money? So that's the extreme conversation on that. But again, have a plan. Next question.
This question, can we use PPP loan to pay for 1099 independent contractors? The answer is no. You cannot use it for independent contractors. What happens if we work more hours once we open, or if we need to increase hygiene days? Is that going to be taken into consideration? And if we lay off the associates instead? Again, like Bernie said, don't let the tail wag the dog. So we definitely, still are going to be waiting for more guidance from the SBA. And I just wanted to make you aware there's going to be possible reductions to the forgiveness if you don't bring everybody on board. But you have until June 30th to remedy that. And there's going to be more guidance to come out. So don't make decisions right now.
Well, that's right. And let me just add to that too. Because the PPP program is out of money right now, it means that some of this money on the second tranche is not even they're going to have to extend that 8-week period beyond June 30th. So again, this stuff is all playing out in real time. And I think, again, the PPP program is nice. I think it's a gift. I think it's a great thing that's going to happen here. And I think you'll all end up being able to get it and take advantage of it in one degree or the other. But start focusing on your business again and run it, run it the way you would do it to get to profitability as quick as possible.
Yeah. And one thing, I mean, you don't have to spend it all as well, because at the end of the day, if not all of it gets forgiven, you still have a pretty nice loan at 1% for 2 years. So, I mean, I think still it's a good deal all around.
Yeah, and we're even hearing now too that some of that, if some of it's not forgiven, worst case scenario is you got a 1% loan for the following 18 months from December. But you could also roll that in and refinance that into your SBA loan if you had an SBA loan too, and then string it out over many years. So I don't see a downside to it. Don't overthink it. I think more what I want you all thinking about is your practices right now. It's time to get into transitional phase and get ready to play offense again.
Right. And, I can't stress that enough. For many people, they're always surprised to learn that dentistry is one of the most profitable businesses in America. You and I probably know this, Bernie, but sometimes a lot of our clients don't realize how profitable their business is compared to other businesses. So focus on the goose that lays the golden egg for you every day. So I couldn't agree more with you. I think that should be the focus, is how can we open back? How can we get back to production safely without compromising, of course, patients' health and the team's health. But this ain't gonna be the norm forever. There's gonna be better days coming sooner rather than later.
Well, that's right. You got to play the long game. And again, I can't emphasize enough, the better job you do with communication with your patient base is going to ensure that you have full schedules quicker. So when I say make 25 calls a day, I mean it. I mean, get out there. You can turn a negative into a positive on the marketing side of things by really, really following that advice. Because, look, nothing's going to happen until patients are willing to come back in. And if they like you, they trust you, they have an emotional connection to you, they're going to come back. Yeah. And if you were just a necessity or just a covered benefit, you're going to be less inclined to come back as quick. So I really, really would focus on that. And I would put a major emphasis on that with my team and how they're taught to be scripted and communicate to fill those operatories back up again. Any other questions, topics?
Yes, yeah. And we have about 8 minutes left, so we'll be able to get through all the questions. Since the amount of forgiveness would decrease if we let some employees go, would there be any chance for hiring new employees? I think it's an excellent question. I don't see any language in the text of the Act, the CARES Act, that prohibits you from replacing employees. So we'll have to just wait for more guidance on that.
Well, yeah, and let me give you a comment on that. That's a great follow-up to what I made as a statement, which is this is the chance that every doctor has to come back to full strength with a team only.
Yes.
In other words, if you've got marginal people on your team and you weren't happy with them before this all came down, this is your chance to reevaluate. And quite frankly, if they're not adding massive value, then I'm not so sure that you shouldn't be taking this as an opportunity to upgrade your team.
Absolutely. Just over a month ago, Bernie, the biggest, question that most of our clients had was, how can we bring on good people? That was like the biggest challenge, is finding the right people. And all of a sudden now, there's a lot more supply than 4 or 5 weeks ago. So. Oh yeah, there is.
And some really good talent too. Yeah. So again, I mean, this is going to be kind of a buyer's market for the employers coming out of this, which is another positive. Yeah. What other questions?
What is the code for sterilization?
Well, what you have to do is you have to create a customized code. In your software, if you take a look, the 9000 series ADA codes, those are all customizable codes, and you can create whatever code number you want in the 9000 range. And I think it just needs to stay sterilization materials surcharge. And if you want, you can get with some of my coaches locally in Santa Clara. They can give you the exact wording on that. But I believe you have some autonomy because of the non-covered benefits act. I highly recommend you do that. I mean, like I said, I gave you an example. I think we've got it figured to $12 to $15 per patient when you add in the N95 mask and all the other things that are going to come down the pike. And I think in $1 million practice, that can add about $6,000 a month to revenue, which is big.
Yeah.
So get that mastered for sure.
Yeah. Another question is about how will dentists deal with hygiene exam checks, constantly changing PPEs as they move from one patient to another? Complete change, count on less aerosols and hygiene rooms. I don't know. I mean, what do you think, Bernie? I mean, are they going to have to check with their OSHA advisor?
Yes. I mean, well, again, that's one of those things that I think is a really fluid situation right now. And I don't think that the CDA or the ADA can give definitive guidance right now, or Cal OSHA. I just don't know where we're at with that right now. And that just cements in the concept that the cost of doing business will be more, and you're going to need to charge for it.
Yeah. And again, I mean, you mentioned earlier that probably hygiene is not going to be coming back immediately.
No, and here's the other thing on hygiene too, guys. You're going to need to allow for a little longer visits. And that's why I say, maybe you're bringing back one hygienist with the use of an assistant, where if you wanted to run 2 rooms, do it with assisted hygiene. But I think that there's an additional probably 15 minutes per hygiene visit that's going to need to be built in, just because of all of the new behaviors and just the conversations and the reassurances that have to be given to the patient.
Yeah.
The other thing is, I know in a lot of our offices who are doing emergent care right now, those patients are being asked to sit in their cars. They're being called in one by one. It's not like we're going to put people, a whole bunch of people in a reception area together. So your protocols are going to change. And that's why it's so important that you and your team are handling all this now over the next couple of weeks, before May 4th, before whatever that day is that you open, because you're not going to have the time to make these decisions on the fly, and you shouldn't have to.
Great. We have still a few more questions, and we only have like 1 or 2 minutes, so we'll try to zoom through these really quickly. I applied for PPP loan through B of A, not approved yet. Should I apply through another small lender? As we know from today, the SBA said that all the funds have run out, but you could always try maybe to contact a small lender, and maybe hopefully you could get in line for the next wave if it happens. But
well, the challenge, I don't know that right at this particular moment in time, any of the banks are even accepting new applications, because there's no money in that bucket. But if you do have multiple banking relationships, then I would probably contact that secondary bank, maybe it's a smaller bank, and see how you can get in the queue, because there will be another tranche of money, guys. As soon as they stop treating it as a political football in Washington, that money will get cut loose. And on a bigger grand scale, let me just make sure you guys are clear. I'm not a macroeconomics major, but here's one thing I know. I know that the 2 times that a country gets really concerned, and why the criteria for printing more money into the federal currency, one is the fear of inflation. The second is the fear of the devaluation of our U.S. currency in world markets. You got to remember, right now, neither one of those exist. And my gut tells me that if the feds have to print as much as $10 trillion, they will do it. And I think, and that's why I think there's been a lot of talk of late about a long-term recession or even a depression. My gut tells me that's not going to happen. Mm-hmm. My gut tells me that, this economy was too good before it started. and that the government has too much on the line to not just print money. And it's not just us. I mean, if you look at Monday, Japan printed $1 trillion of new currency. It's happening all over the world. So I think we're going to replace a lot of that lost revenue. I think in some cases, it might even have a reverse effect where with all this PPP and SBA money and all these other funds that the feds are putting into the national circulation, I mean, it may be a windfall. We just don't know yet. But I tend to focus on the positive.
Yeah.
What other questions do we have?
You guys, there's a lot of questions coming in on the chat about part-time
I'm
employees.
I'm happy to stay, Megan, if your channel can handle it. I'm okay with it.
Yeah, I think maybe if somebody can address part-time employees, are they covered under the PPP, and can they stay on EDD for reduced hours even if they bring some of their staff back remotely part-time?
Yes, that's absolutely yes. In other words, they should stay on unemployment, but also come back as needed on a part-time basis. The only thing we're asking is make sure you notify EDD that you have been working part-time. But yes, that's an absolute yes, and that's going to need to happen in a lot of your cases.
Yeah. Well, I think I will just say to everyone, I have both these guys' email addresses. So if you need to get in contact with them directly, just email me and I can get you their contact info. I'd like to thank you both so very much for doing this for us. I know it's been a huge benefit to the members, and I look forward to seeing Bassim on Monday for our next webinar. I also wanted to let the attendees know that the Dentist Supply Company, which is a part of CDA, is trying to obtain N95 masks. So keep checking on their website, because that's the important part about getting back to work, is that we need those.
Yeah, that's great call, Megan. And again, use every resource possible. I don't care if it's seeing what Amazon.com can do for you, or Shine or Sullivan, or Shine or Patterson or whoever it is. One other final thing, as far as for Fortune, I'd all invite you to go to our national website, because there's a whole COVID-19 section, tons of resources for you there. That's fortunemgmt.com. And you can also contact any local Santa Clara coach through there, including myself. I tend to be a little busy these days, as you can imagine, but we've got a whole team of coaches in the Bay Area that are standing to, ready to serve. But there's also like podcasts. There's a podcast on shadow hygiene scheduling. There's all kinds of cool resources if you just go on to our national website. So I would use that for sure. And my final thought is dentistry is not going to fix itself. You guys have got to get back in there, and we got to fix it and bring it back to life. We are an important part of the healthcare system. We cannot sit on the sidelines. And it has been my pleasure and my privilege to join you guys today. And Megan, if you need me to jump back on in a few weeks or wherever we think we're at, I am always willing to lead with my giving hand. I hope it's been valuable today. Thank you.
Yeah, we're going to consider whether we do more of these going forward, depending on what happens. So.
Sounds great.
Yeah, and they've got the resource. If they wanted to get into the recovery program through Fortune, they can all do that through the website as well. And they would then have a weekly 1-hour webinar, a weekly set of instructions, a weekly one-on-one call with a local coach. And as we got them back live, we'd even tap in with virtual monitoring, cloud-based monitoring, and bring them all the way back. So they've got resources through Fortune. We are totally committed to the dentists of Santa Clara County.
We appreciate it. Thank you, guys.
Thank you, Megan.
See you soon.
Ciao for now.
Ciao.
Bye.
Bye-bye.